I am a physical therapist, about 16 years of experience. I've worked in Manhattan with NYU orthopedic surgeons, post-op for, different sort of disc issues, post-operatively and conservatively, neurological problems. I opened my own practice basically because I was sick of watching people getting milled in and out of practices where you're kind of like in a big room and no one's really looking at you. I worked at places like that. I didn't think it was working to the benefit of the patient. I thought that it would be, I loved when I had time with people. I loved when I could work on them with my hands and help them really discover how to move their bodies and really tap into those deep muscles and learn how the body works. I mean, a lot of learning has to go on when we're healing as well. So it's not just about, do this or do that. It's really about learning the particulars on what's going on with your body. Everybody's very, very different. So it's really discovering where your limitations are, what you really should be doing, shouldn't be doing, what do you need to avoid, what do you really need more of. Those sorts of things take time to discover and learn. And I find in places where we're just not allowed to give that time to a patient, that doesn't happen. And I think that in my experience, many times that lack of time one-on-one with the patient is basically the reason that people don't do well, because obviously I'm biased. I'm obviously a physical therapist, and I think physical therapy is great. But I know that if you're doing physical therapy and not getting the one-on-one care that your body really needs, that it might not work. And then, we kind of chalk it up and say, oh, well, PT didn't work that time. But, I think there's a little bit more to it. I think we need to be a little bit better in terms of helping people one-on-one. So that's what I do here in my practice. We do one-on-one care. It's 45 minutes in a private treatment room with a doctor, physical therapy. We specialize in helping people, I say ages 40 plus, stay active, healthy, and mobile, with minimal use of pain pills, surgery, or procedures. And the reason I say 40 plus is because, of course, we will take younger people, but things tend to go downhill as we get a little older. So, and I think people need help. And I think that, I think historically in physical therapy, a lot of PTs get into sports rehab and apply those same concepts to people that are older. And I don't think that's the right thing to do. And that's, I think, another reason that people don't always get better with PT and not understanding sort of the layers of the aging body. So, that's my specialty. I've worked with people who have had, arthritis in multiple joints, and how to manage and how to maneuver and how to be really creative about optimizing motion for them, optimizing movement, so you can actually, go and do the things you need to do. So this lecture is for anybody, really, anybody who sits for work, anybody who's active and wants to continue to be active, but is having aches and pains. People who are using their body professionally, like actors, singers, athletes. I'm actually helping a professional singer right now and helping him with his neck. And he's telling me about how his voice teacher is noticing that he's got way more range and he can get deeper into his voice because of the release that we've done in the neck. So I just think that's really cool. So, also anybody who's had neck or shoulder pain for some time now and really looking to kind of avoid surgery or not use pain pills as much as they are. So I was asking before, if you're specifically wanting to learn about something and you want to let me know what that is, I'd be happy to hear what it is. If you want to write it in the chat, that would be great. I'd like to have it be interactive, so if you guys have questions, that's no problem. Go ahead and ask. I'm going to be looking at my lecture, so I don't know if I'll pick up on the chat comments right away, but I'll check it every now and then. Yeah, so what we'll learn today is why so many people suffer with neck and shoulder pain, why it's such a common thing. I'm sure you guys sort of already are gathering why it's so common. I mean, we're sitting a lot, right? We're stressed a lot. There's a lot going on. somebody, I mean, almost everybody who walks in here, my patients say that they're stressed, and who isn't? I mean, I say that if you're not anxious, you're not paying attention, because there's a lot going on. So it's okay. It's not about not being anxious. It's not about not being stressed. It's really learning how to manage it so that it doesn't affect you physically, because it will. There's no doubt it will affect you physically. It'll affect, you'll have, you know, being overly stressed for many, many hours in the day will cause neck pain. It will cause headaches. It will cause, and it's truly, it's not in your head. It's truly physiological. The muscles are reacting to your stress. The muscles feel your pain and your emotional stressors. It's there, it's in the muscles. So, you know, there's no question about that. So we just need to learn how to manage it. I have some tips about that as well. But obviously, if you're feeling good, you can do more and you'll feel even better. So the idea also is to get you active with less pain and feeling better, because we know that motion actually helps people, and activity and exercise. I mean, who doesn't feel good after they've exercised, after they've, you know, taken a walk, or, you know, whatever, you know, something active. It's just, or being outside in general, it's just, it's necessary. And we have to, you know, my goal for people is just let's just get more active. And if you have pain, wherever it is, let's figure out why it's there. Let's get rid of it and get you back to doing your activity, because that's it. I mean, we have to keep moving. So also I'm going to go over, I have some little cool anatomy apps. I'll go over some stuff with you guys in terms of anatomy, just because I think it's really cool to see it on the spine and how the vertebra kind of move and what's happening when you're actually moving your head and neck. You know, why it can be difficult to decipher if the pain is originating from the neck. Is it the neck? Is it the shoulder? Is it both? They're very connected. I'll tell you, they really are. You can't, most people who have neck problems have shoulder problems. Most people who have real shoulder issues also have neck problems. So they really go hand in hand. And there's, you know, good reason for that, but also, so we also want to find out, I'm also going to let you guys know why it's so important to find out the root cause of your pain. So it's not just enough to say, oh, hey, you know, your discs are kind of crappy. Like, I think, you know, we have to really figure out why, you know, sure, it's arthritis, and sure, you know, we're getting older. I understand that, and we get that, but why now are you in pain? You know, why today? Why not, you know, a year ago? What's happened in the last year? Like, this, try to kind of, you know, I'm really annoying. I ask a lot of questions, and so I like to find out. I'm never okay with the like, oh, that's just the way it is. It's just not my thing. I'm not, you know, we want to find out why. We really want to dig deep, right? So I'll try to, you know, give you guys some of that thought process as well. Give you some really great tips on how to save your spine and reduce or eliminate pain. 10 benefits of good posture, and I will go through proper standing and sitting posture. We will go through some exercises. I'm not going to like go and do the exercises per se, but I do have a couple of videos I could show you, just because I think it'll get a little bit difficult to keep engaging with the screen and do the, usually if I do these things in person, I will go through a whole session. I'll have everybody get up and we'll do some exercises, but I don't know, maybe we'll do that later if you guys, we have time. But anyway, so yeah, so we're going to start off with some neck and shoulder girdle anatomy. So we talk about the neck, right? We are meaning to talk about the cervical spine, right? We talk about your cervical spines. You have 7 cervical vertebrae, right? And we have a disc in between each of those. And the disc provides us with some little bit of a ground reaction force, a little bit of buffer between the vertebra. And when we say that, you know, there's some degenerative discs, you guys, I'm sure you've heard that diagnosis, or on your friends or on yourselves, that you have some degenerative discs. That becomes an issue because the cervical spine is a really mobile part of the body, right? So what I mean by that is, you know, you have lots of different ranges of motion. So we can turn the head all the way. Maybe some of us can't. It is, you know, when we get a little bit arthritic and stuff, we start to lose range of motion. But typically we can turn the head, you know, almost 90 degrees to look over the shoulder. We can turn the head 80 to 90 degrees is normal. So if you don't have, and when I say 80 to 90 degrees, I mean the angle between from here to here, right? So that would be 90 degrees at my shoulder, and anywhere between 80 to 90 degrees of rotation would be normal. So we look at that. Obviously in arthritic situations, a lot of times that's lost or significantly reduced, and it can cause a lot of issues. I mean, we're going to have issues with driving because we can't really look over the shoulder very easily. In physical therapy, if you're having issues with that, we want, and it's so degenerative that, I'll say, what, it's almost like that it's fused, almost that it's so stiff that it's just not going anywhere. So we have to figure out where to get you motion elsewhere. And it's typically going to be from below, and we're going to learn how to move the body in that way so we can get you back that motion so you can safely drive, right? So let me just kind of show you, I have a cool little app. Okay. So go back to screen sharing. Okay, can everybody see that? All right. So here is our skeleton. I was playing with him before, so I'm just gonna take away some muscle layers so we can start from the top. Okay, so there is our skeleton, right? I'm gonna take away the nerves. We can add and take away. So there's the skeleton, all right? What we want to see on a person from this view, side view, you can see the teeth, the skull is in the back here. What we want to see is a natural, what's called lordosis. We want a natural curvature of the cervical spine, that it's curving inward, right? In people who have degenerative changes in the cervical spine, people who sit a lot for a living, we start to lose that natural curvature, right? So this curvature starts to straighten out on people. And why that's a problem is because when we start to lose the natural curvature of the spine, we actually start to put pressure where pressure doesn't belong. And that's what really accelerates the process of, degeneration of the discs, or even some degenerative facet joints or joints, on either side of the spine. So, you also have, obviously, and here you can see, I'm going to add some muscles. So here we can see some of the deep muscles in the head and neck. So you can tell how closely related these deep muscles are. Here we have longus colli, right? And that muscle runs all the way from the base of the skull all the way down into almost the mid back. So it's not uncommon for us to have, people who kind of sit for too long throughout the day, who are sitting for a living. It's not uncommon for us to have people come in with, middle back pain, shoulder pain, all originating from really like a forward head posture, prolonged sitting posture that's causing stress and strain. So here's another layer of muscle, right? And these muscles are true to form. So they're coming in the layers that they are actually arranged. So we have these front neck muscles here, that again, if you're in a prolonged sitting position where you're consistently looking down or consistently having the head forward, a forward head posture, it's just going to put, and when I talk about that length tension, it's just going to put a significant amount of lengthening to the front muscles and shortening to the back muscles. So if you guys think about bringing your head forward, right, chin forward, which kind of like what we do when we, a lot of times drive, typing on the computer, working on something, that the chin is forward of the head, and the head is, it's kind of heavy. So we need these muscles to do their job at holding us in neutral. Otherwise, this forward position of the head and neck, it causes so many issues. It's going to make it so that these muscles, see the muscles in the front that run all the way down into almost like the first thoracic vertebra, they will be in a prolonged lengthened position. Problem with having a muscle in a prolonged lengthened position is that that will cause, that will cause that muscle that's in a prolonged lengthened position to become so weakened to the point where, you know, we're almost unable to get back into neutral spine for the neck. So it then causes a shortening, right? So if you bring your chin forward, you're getting a lengthening of these muscles, and then you have the vertebra, and in the back, you're going to get a chronic shortening of the muscles in the back of the neck. So those muscles get really tense. These muscles get really long, and this is all from just sitting the wrong way and having the head, you know, just forward of the body. Lots of issues ensue, right? So one of the things that happens is also that if we're in this position for a prolonged period of time, you actually become a mouth breather, because those muscles pull even down on the jaw, and the mouth kind of stays open as you're working on things. You become a mouth breather, and that's actually not a great way to breathe, because if there are, you know, that viruses, bacteria lurking in the air, right, and we're mouth breathing, well, that's going to go straight into our system. That's going to go straight down your trachea into possibly right into your lungs. So we need the nose to breathe in air, because the nose has these turbinates. It has the hair. It actually catches viruses and bacteria before it's able to get into the system, and it can actually filter it out. So if we can breathe through the nose, then this is a really important thing for just general health. We can actually get sick less. But bringing it back to the cervical spine, the reason so many people are mouth breathers is because their neck is always so stiff and rigid, jaw kind of chronically stays forward, and the mouth is just open while we're doing certain activities. So I'll just quickly take you through a little exercise. Go ahead and sit up nice and straight, chest up, shoulders back, relax your shoulders, all right? Because I just can't watch people slouch, just makes me nuts. And let's just work on taking the chin, right, and bringing it in towards the Adam's apple, you know, or the trachea if you don't have one, right? And then take your thumb and see if you can like kind of lock in and almost like you're going to pull on your jaw, but your jaw is not going anywhere, because you're really using your muscles to kind of stay there. Don't get your muscles in here involved. Keep those shoulder muscles relaxed, you know, like isolate a contraction of those deep neck muscles. Let's get those muscles to fire. That's a really important thing, guys, to really learn how to do. That's one of the things like I always do, is try to teach people that. It's so important. You know, and then learning how to breathe. So we want to breathe through the nose and out through the mouth, right? And think about also, when you're thinking about, you know, sitting in good posture, thinking about that your inner ear is lined up with your outside of your shoulder. So if you take like your finger or whatever, put it into your ear, and if you're here and you drop a line, you know that it's forward of your shoulder, right? But if you take that line and or to the side of the shoulders, you're in line, right? That's good alignment. That's good alignment for the upper body. And truthfully, this is everything. Like, I can't, you know, stress enough how important that is, to be able to sit properly. Yeah, so that length tension relationship between cervical spine and between the muscles of the neck and the muscles of the head. I mean, so like I said, so these muscles in prolonged forward head get really long and weak, actually, and the back muscles get really short and weak. So that actually, so those short muscles a lot of times cause headaches. We call those cervicogenic headaches. So because the muscles are so shortened, they're actually sending signals to the head that something is wrong, and something is wrong. The muscle is shorter than it should be. So that's the headache. A lot of times that shortened muscle will refer pain to the front of the frontal bone here on the same side. So yeah, so let's see, I think that slide.
What was the name of that muscle? The short one that gives the headaches?
Suboccipital muscles are typically the ones that they attach to the occiput, to the back of the skull. That's the suboccipital muscles.
Thanks.
Those are really, they actually sell, I have these little yoga balls I use for that. You can lay on these little balls, put them right at the suboccipital muscles and kind of like lay down on the floor and just work on your breath and release those muscles. They have other devices where it kind of presses a little harder into that area. Of course, like a massage, somebody who's, you know, trained in releasing the head and neck in that way, that's really, really helpful for headaches as well. So yeah, so is it the neck? Is it the shoulder? We have to find out. It's really important for us to be able to figure out what the culprit of the problem is. So disc problems in the neck. So if a disc problems are, you know, basically after starting at age 25, 30, our discs will start to sort of, you know, degenerate. How fast that happens is up to you. I'm just going to tell you, it is a process that I don't want to say inevitable, because I never say that. I always say, you know, there's something you can do about it, but it does start to happen at a certain age. If you take an MRI of a healthy individual, maybe age, let's say 60 with no, or even 50, let's say a 50-year-old with no neck pain, no head aches, no shoulder problems. But if you take an MRI of their neck, I mean, you're going to find some degenerative changes. It's not a matter of if, right? It definitely is there. But why do some people have degenerative changes and no pain? That has a lot to do with the lifestyle and the posturing and the strength. I'm going to talk to you guys about that. So referred pain is another tricky one, right? So where, you know, I've had people who've had these sort of, so after COVID happened, I had a tremendous amount of neck and shoulder, and this is, I guess, what prompted this lecture, but tremendous amount of neck and shoulder patients coming in for just terrible pains into the jaw, even causing TMJ, lots of headaches coming, and a lot of it was this tricky little muscle here. It's called the SCM that I've been working so hard to release on people. A lot of people had, I don't know if you guys noticed in the review, in the bone anatomy, but the first rib, guys, it lives right here. So the neck muscles attached to the first rib. And if those muscles get, we talked about the front muscles and the back muscles, but if those muscles in the front here get tight enough, they can actually pull up your first rib. And I didn't show you the nerves on that, and I will, but the nerves run right underneath that clavicle, right underneath your shoulder, your collarbone, right underneath your collarbone, or, you know, brachial plexus, a bunch of nerves, basically. So if this muscle, so just tracing it back to sitting posture, muscles getting tight, if this muscle gets tight enough, it can actually pull up the first rib, scalene muscle and SCM, that's what they're called. It can pull up the first rib and actually cause nerve compression. And you can actually get pains that'll feel like nerve pain down into the hands, you know, into the shoulder. It doesn't always have to go into the hands. Sometimes the pain can kind of localize in the shoulder, but it will be of origin in this area. And this area, I've shown people some self-release techniques that are so helpful. So if you feel on either side, I know people are kind of like weird about manipulating the front of their neck. I think it makes you feel like you're getting choked, but it's a really good thing. So just find those muscles on yourself. It's a really, really great thing to learn how to do. Just go ahead and kind of two hands and find those muscles in the front, right? If you feel that one of them is tender, right, and it comes, so this muscle, it starts at right behind the ear, and it works its way all the way down into where the collarbone is, okay? And if that feels tender to you or tight, it's a really great little self-release technique that you can just kind of massage into that muscle. It's really doesn't take a lot of effort, super effective, gives a lot of relief, improves range of motion in the neck. So there's lots of stuff like that you guys could be doing. You know, and when I know obviously specifics on someone's problem and I've examined them, obviously I can give them more, you know, direct plan as to what needs to be released. But yeah, referred pain doesn't, so what I just described was that muscle got so tight that it pulled up the first rib and it caused nerve compression, and the nerve, then you feel the nerve down the hand into the finger sometimes. Sometimes we think it's carpal tunnel. I'll tell you, most of the time it's not. Carpal tunnel actually can only affect the first 3 fingers and half of the 4th. So just so you guys know, if you're having any tingling on the outside of the hand, or if it's on the back of the hand or something like that, it's probably not carpal tunnel. Carpal tunnel is also an occupational thing. You know, it's usually people who type. So if you're not a person who's on the computer a lot and you're getting a diagnosis of carpal tunnel, or if you're getting a diagnosis of carpal tunnel on both hands, I'll tell you, it's probably your neck. Just, I've been doing this a really long time and it happens a lot. So referred pain is a pain where the origin of the problem is somewhere, but the pain is elsewhere, right? And this happens a lot in the lower spine, actually, in the lower lumbar spine. We have people with lumbar problems at L1, L2, where they're actually having pain in their groin. So that's called a referred pain pattern. And that happens as a result of just some of the way that the body organizes in the brain, where a specific area will have sensation in what area. So it's just the way the body organizes, the brain organizes the body. So, you know, we can have a specific area of the spine where pain is felt elsewhere. So always we're looking at the spine, we're always wanting to keep your spine really healthy to avoid these issues. Another problem that we have in the shoulder a lot of times is a frozen shoulder. As if anybody's had that, it's really sucks. It's so painful. I haven't had it, but I've treated a lot of people with it, and it takes a really long time to get better. And a lot of times with frozen shoulder, because you just don't have the mobility, the neck ends up going out as well. So you can see how these things overlap a lot. Basically, I'm just going to say that if you have a shoulder problem and the person isn't treating your neck, that's not right. It's absolutely something has to be done with the neck. It's always involved. And I just went over sort of some of the rib problems that you can even have, lower rib problems that can cause issues with mobility in the neck, in the middle back. So yeah, some people have a combination of these problems and they don't have a clear diagnosis or plan of action, but you really have to know what the problem is and where it's coming from, right? So it's not enough to say I have neck pain. You really have to go to somebody who is going to figure out where it's coming from. Is it the first rib? Is it the vertebra that's shifted? That sometimes at one of the vertebra, actually, we have these little joints that stick out of the vertebra on either side, and they can actually sublux or shift and kind of like get stuck in one position. So that's kind of like an easy fix. We can always fix that. I'm a manual therapist, so a lot of times I'm, you know, actually physically fixing stuff like that where we put it back into place. But sometimes people have that and, you know, a shoulder problem. So, or the shoulder problem came because that's been there for so long. So what I'm saying and what I'm trying to get across to you guys is that neck and shoulder pain isn't a real diagnosis. I mean, you really need to know what the source of the problem is, right? So, you know, the plan has to involve a specific, you know, like this is where the issue is, and this is why we're going to strengthen this muscle and try to lengthen this muscle so we can find balance. The body wants balance. So it's just very, very important. So some tips, right, on how to save your spine and reduce or eliminate pain. So I'm kind of like working on a book. I hope I get it out soon, eventually, but it's really going to be about the spine, right? So doing tons and tons of research all the time, and of course all the stuff I've learned, and of course all the stuff I've learned from all my patients who they're my teachers just as much as anybody else. I'm able to, you know, learn from their bodies. That there's some real like things that are standing out in the research on what's optimal, what we need to be doing to really save our spines. And I'll tell you guys, you're only as young as your spine is flexible. If if you're starting to get really rigid and kind of stuck and you can't move through the spine, you can't do as much, right? And you're prone to injury and you're prone to illness even, because if a really stiff and rigid spine, you can't get a full, can't fully expand the lungs and get a full diaphragmatic breath. So, we're going to lead ourselves down some problems. So I think like keeping the whole spine really healthy, mobile is critical. I mean, I'm going to be talking about this a lot. Hopefully I'll do a lot more of these now that people are starting to come out. We're going to be doing them at my office as well, inviting, small groups to kind of talk about this stuff and figure out how we can get our spines in a better place moving forward. I think we need to get better at aging too. So my goal is to try to help people with that. So, yeah, so improving your posture. That's number one, right? Number one on the list is getting better posture. Learning what that is, what is good posture, how to keep it, and what we can do for you in order for you to get that. Because a lot of times, people don't really know what that means, or they don't really know where their head should be in space, or their shoulders, or their back. So, that has to be learned and practiced, definitely practiced. And then performing a daily customized stretching program daily. When I put daily in caps because this stuff has to be done every single day. I think if you're over 40, if you're not stretching every day, I don't know how you're going to feel good. It's like it's not a big ask. I mean, like literally some of this stuff, it could take 5 minutes and it makes the biggest difference in your body. Quick little mobility movements. It's nothing crazy. Sometimes you don't even have to get on the floor. If you can't get on the floor, that's totally fine. But stretching daily is a really biggie. It's a big thing. Even for headaches, even for, a neck ache that you think, oh, why should I be stretching my legs or my lower back? But it makes a big difference because that's your base. Practicing deep breathing, super important to expand the lungs, work the diaphragm. So when we practice deep breath work, the diaphragm is a key player in the core, right? So the diaphragm sits right underneath the rib cage, right underneath the lungs. And that diaphragm, the muscle of the diaphragm actually expands. Here, I'll show you guys. I think I'm still screen sharing. Yeah. Yeah, so the diaphragm lives, I'll show you really quick. Yeah, so that's your diaphragm right there. That highlighted part, okay, that lives, it attaches to the ribs, it lives right underneath the lungs, okay, and that's actually, that diaphragm muscle is one of your core muscles. So when we do deep breath work, you're working your core, okay, and also a lot of times the ribs will get stuck, fixated up, and working the diaphragm helps to improve mobility in the ribs. Why we care about the ribs? Because it affects your neck, it affects your mid back, your lower back. We care a lot about the ribs. So yeah, that's that muscle. Super, super important to get that breath work going. Strengthening your spine is huge. I mean, I'll show you guys a couple of things. I'm not going to have time to go through like a whole routine, but I'm going to show you a couple of things. Sitting in ergonomically appropriate chairs, move often, never sitting for more than 20 minutes at a time, hydrating. I mean, I can't tell you, like, the reason discs get degenerative, they're dehydrated, like literally. So drinking water will help your discs in your neck. So definitely drink a lot of water, not seltzer or tonic, water, like just water. So water with lemon is fine. Good job. I saw somebody grab their cup. Nice, Heidi. So keeping inflammation low in the body, not relying on painkillers. If something hurts, this is huge. Most of the time, most of the time, I won't say all the time, but most of the time things don't go away on their own. So if something's hurting you, find out why sooner than later. You know, don't let pains linger for too long, because it's not gonna go away, and it's probably gonna cause a bigger problem than what you started with. So if you're having just like a little ache or a pain that's just always there in one specific area, I would say go and get it looked at, you know, figure out what it is, figure out how you can either stretch it out, or it might be something so simple as, you know, do this stretch, you know, 2 times a day or whatever, and, you know, this thing will go away. It could be so simple. So just, you know, get the help you need whenever you have those little aches and pains. Also getting quality sleep is really, really, really important. So I'm talking about posture, right? But if you're exhausted because you haven't been sleeping, it's really hard to sit up straight. It just is. It takes effort, it takes energy to sit up and to work on your muscles in that way, even to exercise. So if you're sleep deprived, that's definitely a problem.
Can you touch on pillow usage?
Say it again, hon? Sorry, can you repeat that?
Sure. Can you touch base on like pillow support for the neck and the head?
Pillow support?
Mm-hmm.
Yeah, so I never recommend that people sleep on their stomach. Stomach sleeping is it's just not great for the neck, because if you're on your stomach, you're gonna have to turn your head all the way to one direction, and that can put a lot of stress and strain on the discs and the vertebra. So if you're a stomach sleeper, first of all, try to definitely not do that. You want a pillow that is going to be sized appropriately to you. You generally, the rule of thumb is that the pillow should be able to give you enough thickness that it's gonna be between the thickness to cover the area between the ear and the end of the shoulder. So on me, just to give you for reference, like on me, that's like the pillow should be this thick, and a lot of pillows aren't that thick, right? So a lot of pillows are like half that size. So, yeah, a lot of times people are sleeping on pillows that aren't really right for them. Side sleeping is fine, back sleeping is fine. But yeah, just making sure the pillow, supports your neck lordosis, the curve in your neck, and making sure that there's enough space between the ear and the shoulder. We actually sell custom pillows. That's how much, because it is a big issue, actually. It's a big problem. So 10 benefits of good posture. It will prevent neck, shoulder, and back pain. 100%. It's in the research. If you can sit in good posture, you'll have less problems with pains. It's just, and just so like your goal could be just learn better posture. That could just be your goal, and practice it daily, right? And you can do it anywhere. That's the beauty of it. Sometimes in the car, the headrest, I'll kind of stick my head back against the headrest and work on my chin tuck. And I look like a complete weirdo to the other drivers, but I mean, I don't care, right? And, just working on my chin tuck and my posturing in the car. So it also, good posture will increase your lung capacity, because then, like we said, your ribs, your diaphragm, your psoas muscle, did I go show you guys that muscle right here? This psoas muscle is such a tricky muscle, right? It spans all the way from the inside of the lumbar vertebra all the way to the front of the hip. And when we sit for too long, it actually gets shortened. Just sitting for too long and not working on hip opening and posture will shorten that psoas muscle. Psoas muscle actually has in it receptors that give the brain the message as to whether we're in trouble or not. So a shortened psoas muscle actually can lead to anxiety. So we need to learn how to stretch the front of the hips. And the other thing that happens with a shortened psoas muscle is that it will pull your thoracic spine forward, making it really hard to straighten out. So even if you wanted to have good posture, with that psoas muscle in spasm and shortened, it's going to be tough. So want to learn how to stretch that muscle. Good posture will help you improve your ability and performance with daily tasks. I mean, you'll be able to do more. It will help you to relax. So when I said about the psoas muscle, that it could contribute to anxiety. So that's a fact. And, you know, stretching your muscles daily and being able to sit in good posture will help with relaxation. It will assist with better, more effective workouts. Sitting in good posture is a core workout in itself. So it will increase your core stability. So being in a good posture, sitting on your sits bones with a nice natural curve in your lower back, chest up, shoulders back. I'll go over this again, but that will help with your core stability because you're actually working on your core in that position. You're holding yourself up. It's an exercise. It'll decrease joint wear and tear. So it'll slow the progression of arthritis. So arthritis is, you know, everybody will say arthritis just gets worse and worse and worse. And, you know, there's nothing we can do about it. Well, there is something we can do about it. We can stop it from getting bad that fast, right? We can slow the progression. If we can keep our body in positions more so throughout the day that are healthier, we can reduce the amount of wear and tear on the joints. It'll balance that length tension of the muscular system. So we said when we're sitting forward, this muscle stays long, this muscle stays short. But if we can be in good posture, we're going to have better balance of the muscles forward and back, side to side. It helps with general wellness, less illness. Remember, it talks about kind of the mouth breathing and how that can cause people to become, you know, ill because they're not filtering it through the nose. So it'll help with general wellness, and good posture really just makes you look younger, feel more confident and powerful. So it's all good. So here's some pictures. You know, forward head posture here. You're seeing that the head is forward of this plumb line. We always, you know, physical therapy, we use a plumb line where we want the segments of the body to line up, right? So you see how this guy's ear is forward of the line. He's got kind of a hyper exaggerated curvature in the upper back. That's called a kyphosis. And, you know, a lot of people have kyphosis, a lot of people have rounded upper backs, but it takes a lot for it to become fixated to the point where we can't do anything about it. You know, most of the time people with kyphosis, we can teach them how to become more flexible in that area. This kind of posturing also causes a flat back, which causes those muscles in the lumbar spine and the lower spine to become deactivated. They're not going to fire as well. You actually get deactivation of your butt muscles. Butt muscles are for, you can't get along in life without good butt muscles. I mean, you can't walk up a hill. You can't sort of, you know, just can't walk well in general without, you know, strong enough butt muscles. So take that out. So here's good posture, right? And then another kind of example of poor posture, except where the pelvis has now, instead of pushing back, the pelvis is pushed forward, which we see that as well. It's called a sway back. That causes weak abdominals, but again, very, you know, most of the time, very, very fixable. So you can stand up if you want to try this. If you don't, that's fine. But what you're going to try and do to stand with good posture is, here's your sternum, right? Your breastbone. You're going to lift, think about lifting the breastbone up, right? Lift this up. In yoga, we say that it's the heart is, you know, lifting your heart, okay? So you want to lift your heart, lift your breastbone, stack your head so that it's sitting squarely on your shoulders. Relax the shoulders, right? Tuck your chin while keeping your gaze ahead, okay? So when I say tuck the chin, guys, it's not, you know, it's not that. It's really just drawing the chin back. So your gaze is still forward. So I haven't like looked down or looked up. I'm just drawing the chin back, shoulders, breastbone up, right? In this position, now that we've lined up the head and shoulders, let's engage the abdominal muscles, right? So now, quick little, you know, mistake that people make is that when they go to engage their abdominal muscles, they lift up the ribs will come up. Now I want you guys to actually think about the ribs coming down, that diaphragm muscle. I want you to try and have the diaphragm come down. And then from below, I want you to bring the belly button up towards that diaphragm. So think of a little button at your diaphragm, a little button where your belly button is, and bring those 2 points together to contract your abdominal muscles. Okay, so you're stacked in, everything, rib cage is drawing down, and belly button is coming up. Think about the belly button coming in towards the spine and up towards your head. Okay, so that's stability from below. With the chin tuck, that's stability from above, and we're stacked nicely. And we're actually contracting the muscles that are supposed to be on while we're sitting and working. So again, like if you're doing this even in sitting and you're having to work, it's a great way to be. It's a great little exercise that you can do anywhere. So let your arms hang naturally at your sides. Okay, your thumbs should be pointing forward. If your thumbs are pointing back behind you, it's likely that your shoulders are rotated. You're going to need to work on that. It means you have really tight pectoralis muscles, and you're going to want to think about rolling, opening the shoulder so that the palms are facing forward, or that the thumb is facing forward. Okay, so you just don't want your thumb, like if you're standing there and your hands at your side, you just don't want the thumb to be facing the back. Okay, so that's that would be, a shoulder opening exercise. Quick little thing for that, that's really great, guys, is if you're sitting at your chair and you just kind of, I said I wouldn't demonstrate, but I can't help myself. So it's grabbing here, interlocking the hands, rolling your shoulders back to get the shoulders to open. Really nice, guys. I see some of you doing that. That looks really awesome. Yeah, and if you can't reach your hands to clasp the hands together, that's totally fine. As long as you're, so I see somebody doing it, but you're arching your back a little too much. So keep your belly muscles engaged, but open the shoulders at the same time. So we don't want to like lose center, right? We don't want to lose stability from the inside while we're trying to open up other parts of our body. So just be aware of that. Stand lightly with your feet shoulder width apart. Your base of support is the middle of your foot. So you just want to make sure that you're not putting too much pressure on the front of your toes or too much pressure on the back of the heels, that your base of support is lined up in the middle of the foot. That's really important. Great. So sitting posture, preserve your curve. So you want to sit with a roll or a towel behind you so that your lower spine can stay in a nice curve. We want lordosis, right? That's the goal. So we want to try and keep that. We don't want to sit slumped. If you're looking at a screen, you want to make sure that the screen is in front of your eyes, that you're not having to look down or up, because that really affects the neck for many hours of looking at a screen. You also want to make sure that your arms are perpendicular to the surface you're working on, that you're not having to kind of be here or there, and that your elbows are at about 90 degrees, right? So the elbows kind of there, and that you're not sort of reaching too far forward to type. Making sure you're not looking down for too long. Your knees in sitting should be lower than your hips. Again, you want to maintain that spinal neutral, that lordosis. Also, another great thing to do if you have to sit for a lot of hours throughout the day is to sit with do unsupported sitting. Because you're there for so many hours and you can turn your workspace into a little exercise. So you can sit at the edge of your chair. Now, you were using a towel roll or something for your lower back, but go ahead and, not use that for maybe a minute. Start off with a minute that you're sitting unsupported at the edge of the chair and you're holding that posturing I just showed you guys, right? And now that's an exercise. Now, now I never stopped working, but now I'm actually like firing my ab muscles and firing my back muscles. I'm doing something really good for my body. So, just vary your position. And then if you can, every, hour, I would say even every 30 minutes, get up, stand up, see if you can do some work standing up. Just, or, you know, or periodically, like while you're sitting, if you're having to sit for so long, do little mobility movements, which could be nothing more than taking the shoulders back, right? Squeezing your shoulder blades behind you, taking a little twist in the chair, twisting one way and the other, right? Yeah, you can even, if your shoulders are okay and they don't hurt, you can go ahead and put your arms overhead, kind of reach up overhead and kind of hold that. You could side bend the body this way and that, right? These little micro, I call them micro movements, they make a really big difference. So just keep moving. So when and you know, when somebody says like, keep moving, it's like, where am I, you know, I have to work all day. What do you mean keep moving? But this is really what I mean. I mean, keep adjusting, keep bringing awareness to your physical body. You know, if you're at work and you're thinking work all day long, I mean, that's great. I'm sure that's what needs to happen, but you also need to kind of check in with yourself and, you know, and to remember to do that. You know, every like 30 minutes, let's say, do something, stand up, you know, put your leg in a different position, change something, sit at the edge of the chair, but just keep moving. So, you know, people who sit for 8 hours a day without physical activity have a risk of death similar to those of smokers. So, and it's because sitting puts 10 times pressure on the spine. So again, you know, those little movements, little micro movements, I call them, take a breath, or even just leaning back, taking a big breath, or leaning forward, something, right? Little micro movements, just do something throughout the day. Just don't want to get stuck in any one position for too long. It's just the spine, especially a spine that's, you know, like I said, above 40, 50, it's, you know, the vertebrae starting to get a little stiff, right? So if you're in one position for too long, it's just not a great place to be. All right, I see somebody stretching their neck. That's exactly what I was going to have you do. One of the best things you can do for your body is to start and end each day with some gentle movements that will take pressure off your spinal discs, create space and length in the spine, and improve your breathing quality. So what people always ask me, well, should I stretch in the morning or should I stretch at night? And I'm like, you want my honest opinion? You're not going to like it. I mean, both. You should stretch in the morning and the night. So if you stretch at night right before you go to bed, you sleep better. It's amazing. I can't say I do it every single night, but I do try. I do try to do it every night. I lay on the floor. My kids love it because they lay there too. Kids love being on the floor. So we just kind of roll around and we'll do a little back stretches, and you sleep so much better. And you wake up with less stiffness. I mean, I'm sure a lot of people wake up really stiff, and it takes a while before you can get going. So stretching at night helps alleviate that. And stretching in the morning gets you going in the morning. So like there's benefits to both, but you know, if you can only do one or the other, that's fine. You know, that's one of them would be great. So neck stretching, you know, that kind of stuff. So guys, I'll just not warn you, but I'll just tell you about this little move, right? It's a good one. However, right, go to your limit. Don't go past your limit, because if you have, let's say you have a segment on this side that's really stuck and stiff, and it's just stuck and it needs to be worked on, because the hands-on work that we do, it unsticks those joints. That's just what we do. So if you're stretching a joint that's really stuck and you're going into it, you're like compacting it, you're closing it, you're actually causing more inflammation. So if you're going to stretch the neck and you're going to one side, the side you're going to, if it feels really painful, it's not working. Like abort mission, go the other way. Sometimes people will say, oh, I kept going and going. I'm like, why didn't you stop when it hurt? But they thought they had to keep going. So abort mission, don't go that way if the side you're going to is like really hurting. Go the other way, and then you might find that it'll relieve it to go away from it because it's actually opening it. So just like be aware of those little things, because you know there's people, you know, there's stuff all over the internet of how to stretch the neck, and I mean, I don't think it gets into like the particulars of, you know, if it feels this way, don't do this. If it feels like this, go this way. You know, there's little things that you want to learn. So mid-back stretching is also huge. I think so. A mid-back stretch would be considered this guy, this little twist and sitting. That's a middle back stretch, right? Super, super important. Actually, it aids in digestion, this little move. Okay, so upper back stretching or mid back stretching. Also this, opening the chest, kind of like, rounding and just kind of opening the arms, sticking the chest out as much as you can. That's a nice, and then coming back. Inhale, exhale, inhale, exhale. Super great stuff for your mid of back. Lower back stretches, I'd have to kind of get on the floor, but there's a really great one for the chair, actually. It's a cross leg. I'm going to show you really quick. You cross your leg like so, okay? And you're sitting up, and that stretches your piriformis muscle, which is a really important muscle for the lower back. Michael and his partner are doing it. That's good. That's really good. Yeah. But what you want to do is sit up straight also when you're doing it. You don't want to like slump into it. So that's a really great one for as a chair stretch. Another really, it's a psoas stretch, and I didn't put it down, but I think it's like really, really important for you guys to do, is to get the leg behind you. So this guy, where the leg is going behind you and you're stretching the front of the hip. If you guys can manage that, like every day, that's a great way to just open the whole system and get that psoas muscle not so stiff. It's a nice quick little posterior shoulder stretch. Okay. Again, if it hurts, guys, like if you're doing something and you go, oh, that like it hurts in there, do the other side. If it feels different than the side that hurts, there might be something going on. You might want to talk to someone who can kind of help you through that and why that is. Because don't stretch through, like it's no pain, no gain to a certain degree. It's not always that, if something really hurts, it might be something going wrong. So I don't know if I have like a hard hour or if I'm allowed to go over, but it's been an hour, but I'll just go over. So if you guys leave me your email and your name, I can send you these slides. So if you want. So in the chat, like if you leave me your name and email in the chat, I'll send you these slides. Meditation and breathing, you can train your brain and control your response to pain, right? We can moderate your breathing rate, blood flow, muscle tension with just breath. So studies found that it's better than medication in easing back pain and reducing pain intensity, just learning how to deep breathe by 30%. And the best part is there's no side effects. So if you can, it also helps with anxiety tremendously. If you can get in the habit of setting aside 10 minutes, maybe 20 before you start your day to do some focused breath work in good posture, with the eyes closed, ideally in a dark room, and just work your breath. Just focus on your breath. And when I say work your breath, I mean focus on your breath, meaning like hear your breath, and work your in through your nose, practice in through the nose, out through the mouth. And even if you do it for 5 minutes, even if you do it for a minute, it's good. Okay. So strengthening your spine and shoulders, so important for longevity, for good aging. What we need to be strong in this area. It's not like, yeah, I'm gonna, go to the gym and kind of lift some weights, but like mindlessly. So we don't, a lot of times we have issues. Everybody has it. I have issues. Everybody has issues in the body, right? We all do. But it's learning, like, that's what I said in the beginning. It's learning your limitations and what you can and can't do, and developing a program that is best for you so that you don't have too many problems. But muscle mass allows us to move better. We can do more. We're protecting our spine really with strength. The muscles, so the joints we know, and the bones, people get, a lot of people get osteoporosis, which is a degeneration of bone density, loss of bone mineral density. But if we train with, it doesn't have to be with weights, but it could be with Pilates, yoga, even your own body weight. That counts. That all counts for strengthening. So we can do sort of stuff like that that's appropriate for you. I don't like to get into like too much of specifics of strength training, because everybody is so different in here, and I don't want to give, you know, bad advice basically, but I'm just trying to bring light to how important it is to strength train. We lose 15% of our muscle mass every year after age 50 if we're not training. That's a lot. Like that's really, and that gets replaced with fat, you know, so we start to kind of have weight issues after age 50. Strength training is the answer to all this. It's going to save your spine. It's going to save your bones. It's going to, it's going to help you move better. The muscles are they have a great blood supply. We can make changes in the muscle at any age. Don't think that you're a specific age, you're 80 or 90, that you can't get stronger, because absolutely you can. It just, you know, takes a certain way to do it. And you are what you eat. So, you know, even with the best posturing, the greatest exercise program, a diet that's full of processed inflammatory foods will cause problems. Water intake has to be equivalent to half your body weight in ounces. Keep your carbs low, increase your protein and your good fats, stay away from sugar. Breads, pastas, cookies, candies, cakes, these all turn to sugar if your body can't work it out. And I'm assuming if you're in a lot of pain and you can't really exercise without pain and you're eating that stuff, well, it's not going anywhere. It's causing inflammation in your body and likely keeping the pain going. And yeah, joints can hurt in a person who's inflamed. It can cause joint pain, just the inflammation from the food. So, you know, be really aware of that. And, you know, maybe you need to talk to a nutritionist or, you know, get some advice on that. Don't rely on painkillers for pains, aches and pains, and even even Advil, you know, don't be so quick to pop that stuff. I know it helps, but it's not really a long-term solution. I mean, there's an opioid epidemic currently, so it really shouldn't be the first line of defense for pain. Also, problem with using painkillers too much is that you're missing an opportunity to heal the body naturally with the right set of movements, exercises, certain foods that can help. You're also missing an opportunity to find out why the pain was there in the first place, right? So prioritize sleep. You need 7 to 9 hours of sleep every night for daily recovery. High quality sleep will prevent injury and help you age well. It's in the research. It's absolutely a fact. So how to get quality sleep? Try not to have caffeine after 2 p.m. You know, alcohol with dinner disrupts the sleep cycle. Wine and beer are high in carbohydrates and they turn to sugar. Make sure the room is completely dark. Keep the bedroom cool, because being too warm at night actually disrupts your sleep hormones. And try not to late night eat, because that is all carbs and sugar. Also, falling asleep with the TV or looking at your phone. The blue lights actually inhibits melatonin. So, yeah, so I mean, so what like a holistic PT assessment can do for you, physical therapy assessment, we're not just looking at the neck and shoulders, we're finding out the source of your pain, we're finding out the area of the body that's working too hard to compensate, bringing awareness to that area. We're going to figure out what's tight, we're going to figure out what's weak. A lot of times people are just guessing. Remember I just told you about, you know, stretching one way and feeling the pain on that one side. That's just not the way you should stretch, and it has to be modified. Like, sort of wouldn't know that unless somebody sort of kind of examined you and told you, you know what, you just need to go this way and not that way. It's a real specific thing. Finding out what movement patterns exist in the body, like with walking, with anything that are not ideal and need to be remedied. So we do a movement analysis of the whole body. We're finding out what postural deficits you have and creating a plan. So it's really like a bottom-up approach. We even look at foot alignment, walking patterns as it relates to the neck and shoulders. And it's just, we're creating a plan of action that's inclusive of daily stretching, yoga, customized to you, a weekly strengthening program, and a hands-on session for those rigid joints and muscles and fascia. So that's one thing that you can do for you guys yourselves if you're looking to kind of figure out what is best for me, like what exercises should I be doing, what should I avoid, you know, here's my set of problems, you know, here's how I move, and we look at all that and we'll figure something out for you. All right, I kind of talked really fast at the end, but I definitely can take questions if you have. I just want to let you guys know that I can give you whatever you want. Like if you tell me, you know, that stretch you were talking about, can you send it to me? We use an exercise program. I can send you the stretches. I just need your email. I can send you a free copy of my neck and shoulder pain guide if you want. You can do a free foot scan here in the office where we figure out where your deficiencies are, where your alignment is in your feet. We give away free discovery visits for people who either virtually or live, people who just want to know what they can do, how to optimize their movements, what's best for them. If you just want to like listen, follow me, you can just listen to look at my blogs. It's on my website. And if you want anything specific, just leave it in the chat, name and email and phone number if you like. And if you want to private message me that through the chat, you can also. So any of that stuff is up for grabs if you guys just let me know what your contact info is. This is my contact info. And I mean, I love doing stuff like this. So if you guys have a group that you'd like for me to talk to, I'd be happy to. So you just email me and let me know or call. We're on 232 East Main Street. And that's my story. That's my kids and that's my team. So that's what I got for you guys. I will be more than happy to take questions if you have. Ooh, I got so many comments. It's so exciting. Anybody have any questions they want to ask? You're welcome, Justine.
Thank you. It's very nice.
Oh,